you doesn't know me, I'm Michael Habert. I'm one of the trustees from the village. We have a special guest here tonight. I'd like to thank some of the other village board, the mayor, Alan Beach, Trustee Hawkshurst, Trustee Reardon, Trustee Baccio for being here. So tonight's guest speaker is Dr. Sonny Goel. I'm going to invite Director of Community Education, Abby Fromm, from Mount Sinai Hospital. Abby's a registered nurse, and she's going to do the introduction to Dr. Goel.
Good evening, and thank you everyone for your time. So we're here tonight for heart disease, what are the warning signs presentation. I'd like to introduce to you Dr. Sonny Goel. Dr. Sonny Goel is an interventional and structural cardiologist with a specialized clinical focus in percutaneous, coronary, and structural heart disease interventions. He is board certified in interventional cardiology, cardiovascular disease, and echocardiography. So without further ado, Dr. Sonny Goel, please.
Anyways, I don't know if the mic is working. Is the mic working? Hello? Yeah, actually I'm pretty loud.
Yeah.
So you don't need the mic. I'll give it back to you, or I'll just keep it here. All right, thank you for coming in, guys. My name is Sonny, as you know, and I'm a interventional structural. So I'll not go into the structural and intervention part. Today is more about community education and knowing about your heart. What warning signs that you should be looking out for if you're having problems with your heart, and when to call for help and what to eat, and the follow-up and all those stuff. So we'll go step by step to know what you should be looking out for and how can you manage, and what is the follow-up care on that part. So we'll go, the top myths that you hear about people saying, oh, I'm too young. I don't need to worry about my heart. I'm only 40. I'm working out. I have nothing going on. I don't need to go and see the doctors, which is actually a myth. As you see nowadays, younger and younger population and younger patients are coming into the hospital with heart conditions, based on our diet and exercise levels and our family history. There are certain things that you're not under your control, but you're seeing a lot of younger patients coming with heart attacks. So this is just a myth that you're too young and you cannot get any heart problems. Second is, you have high blood pressure, and, you say, oh, I don't need to worry about it. It's only slightly elevated. If I have any problems, I will know about it. That is also a myth. A lot of patients present to the hospital as a first sign of a stroke or a heart attack in patients who have uncontrolled high blood pressure. So this is also a myth that you don't have to worry about your blood pressure. Also, there are a lot of people who come with a atypical presentation of heart attack. Some people come into the hospital saying that they just feel nauseous. Some people say that they're feeling dizzy. Some people feel that they have having a heartburn, but actually they're having a heart attack. So just don't ignore the symptoms. If you don't feel well, just call your doctor or come into the emergency room. So the heart attack can be presenting at a different ways. It's not always like you see in the movies or on TV that somebody's clutching on their chest. People can have different symptoms of heart attack. Other thing is, a lot of people take lightly that they have diabetes. They think that, diabetes is well controlled. I just need to control my diet, don't need to check my HbA1c, don't need to check my blood work, and everything will be okay. But diabetes is actually a silent killer. It's like having a cancer that eats you from inside. And a lot of people that come into the hospital, they have diabetes and they present with heart attack or a stroke. So you don't need to want to ignore that. Also there are certain things like, the heart disease runs in my family. I'm doomed. There is nothing I can do to save myself now. Of course, I'm going to get a heart attack or a stroke because there is heart problems in my family. So that's not correct. Of course, that puts you at a higher risk if you have a family history, but there are certain things that are under your control that you can do that can prevent you from having any major cardiac or cerebral event. Other thing is about cholesterol also. A lot of people just think that, my cholesterol, I'm just taking this little pill and I'm not going to worry about it. Now I can eat whatever I want. I don't need to exercise. That is also a myth. You have to work continuously towards it, to achieving the good goals. And of course, the medications do help. But also there are a lot of people who can come off the medications if they control their diet and they lose some weight and exercise. Other things is, the heart failure that we are seeing in patients who are heart muscle do get weak. And then they think that, heart failure means that my heart is going to stop. That's not correct. Heart failure can present in all different types. Some people just have shortness of breath. Some people can have swelling in the legs. And it doesn't necessarily mean that your heart is not beating. Your heart is beating, maybe not at full capacity, or sometimes it beats at full capacity, but is not able to squeeze out the amount of blood that you need for your own body. Or the heart is not relaxing properly. So that is other things. The heart failure doesn't necessarily mean it stops beating. Other myth that other people have is there are people who are smoker long time, and then they get cramps and pains in their leg, and then they just ignore it. They think that it's just all my, it is all just because I'm tired or weak, or I have cramps in my leg. So there are people who have peripheral vascular disease, which is also a manifestation like how you develop blockages in your arteries in your heart. You can have blockages in the leg. So the same way you have pain in your heart, you can have pain in your leg. That also means that you might be having some blockages in the arteries in the leg. So you need to visit a specialist, you need to see a cardiologist or your primary care doctor, and they can do some tests, and there are a lot of effective methods to treat that kind of symptoms. Other thing is that, there are a lot of people who have problems like their heart rhythm. When their heart is beating really, really fast, they just blame it that they're just anxious, or maybe they have a lot of caffeine in their body, or they had alcohol, they feel that their heart is racing and they just ignore it. It might be a sign that, you might be having not really a heart attack, but you could be having like an arrhythmia, which is a simple solution. You can just, get it treated with just hydration maybe. So it doesn't necessarily mean that you're having a heart attack. And the last myth that commonly comes up is, I should not be exercising. Now my heart is weak. I already just had a heart attack, so I should not be exercising. On the contrary, you should be exercising more. You should be providing yourself every chance to make yourself feel better, to get your heart better. So more you exercise, the more you exert your heart, the better it will be for the heart. That's why we have cardiac rehab programs where we do monitored exercise for people in the community. Once they have a heart attack, they go join cardiac rehab, and we have seen such a positive response in people who exercise even after heart attack especially. So that is one of the things. So coronary heart disease, that's my specialty. I actually help people who come into the hospital with heart attack, which I want to prevent. The goal in the community is to prevent any heart attack. It's a number one killer in the United States. Almost 400,000 people die every year because of acute heart attack and coronary artery disease. And it provides, it poses a lot of financial burden also in our healthcare system. Almost $240 billion were spent in 2018 and 2019. And almost almost every 40 seconds we have a heart attack in America. At South Nassau Hospital, we see every week I'd see at least one or two patients coming with an acute heart attack. And I'm talking about acute heart attack where they have to be rushed emergently into the cardiac cath lab. And we see almost 100 to 120 patients that come with acute heart attack every year to our emergency room. And then, the males present quite early in their lifetime. So at the age of around 66, and for female is around 70 to 72 when they present with the first heart attack. So as I was telling you, there are certain risk factors that are modifiable. That means that you can work towards it to lower down your risk of heart attack. And there are certain risk factors that you cannot control, such as age, genetic risk factors, or your hereditary, where you're coming from. Especially African American males have a higher risk of having a heart attack. Asian population, South Asian like me, so a lot of people in our community have just genetically predisposed to having more coronary artery disease. So those are certain things that you cannot modify, but there are a lot of things that you can modify and get better. They have a lot of proven studies and a lot of effective treatment for people who already have a heart attack or at a higher risk of having heart attack to lower down their risk, such as tobacco smoking, which is really, really important, controlling your diabetes, controlling your sugar, controlling your blood pressure, and controlling your diet and lowering down your cholesterol. Those are the important things. And also exercise is very, very important. It works in numerous ways. One of them is reducing blood pressure. Other, as you know, it decreases your cholesterol level, plus improve your body sugar levels. So that is very important. Other things that you want to consider is lowering down your stress level, meditating, drinking less alcohol. That also help. And having a good night's sleep. All those things do help. And diet definitely plays a major, major role in achieving this. When we talk about heart attack, there is one concept called as atherosclerosis, which basically means plaque buildup in the arteries. And how does this plaque build up in the arteries? So as you see, there are like normally, this is a cross section, meaning like the vessel is cut and it's showing the inside of the vessel. So there are 3 layers inside the vessel or in an artery, any artery in the body. We're talking specifically about artery in the heart. So when we do a cross-sectional view of an artery, you see there are 3 layers in the artery. There is an intimal layer, which is the inside layer. That's where the blood flows in, that comes in the contact. And then there is a medial layer, which is a muscular layer, basically. That is the muscle made out of the artery. And the outermost layer is the epithelial layer, or we call it as the adventitia. That is the outside layer. So what we're more concerned about is when there is a bad cholesterol or there is a bad substance in the body, it gets deposited in the intima, in the inside layer. And this cholesterol keeps on building, or the bad cholesterol, LDL, we'll talk about it in a little bit, that keeps on building and it causes a plaque formation. So it keeps on narrowing. So there are different types of presentation. When you have this plaque built up and then arteries get narrowed, then you started having chest pain. And when, unfortunately, in some people, this plaque can rupture all of a sudden. And when this plaque rupture, it can cause acute occlusion or a closure of the artery. That is how you get heart attack. A lot of people don't get heart attack. A lot of people come to our offices and saying they're having chest pain when they exert themselves. That literally means that their arteries have narrowed and they're having symptoms because there is not enough blood supply through those arteries. So then we consider doing either a stress test or an angiogram, and we find out they have blockages and we can fix them. All right. So these are like, what is atherosclerosis? Is basically a buildup of plaque in the arteries causing the narrowing and decreased blood flow. When it happens acutely, it leads to heart attack. This we already talked about. This is what heart attack is, and what are the common signs? Most commonly, they come with chest pain. So chest pain is number one. Some people present with shortness of breath, saying that they just cannot catch their breath. Some people come with like nausea. Some people feel dizzy. Some people have different presentations. Some people can just have, just not feeling well, For past couple of days, they've been feeling weak, lethargic, malaise, not feeling well. So they're all different types of presentation. It's not just the chest pain. So you have to keep an eye on it. And if you feel any symptoms, especially if you feel short of breath, chest discomfort, all of a sudden, call 911. Do not try to drive yourself. Ask for help from the family member if somebody's around you. Or call your family members. If not, just call 911 directly and get yourself to the hospital. Today is a cold day, as we were talking about. So what happens in cold weather? Why do we see a lot of people comes with heart attack, especially in cold weather? So cold weather causes sympathetic stimulation in the body. Basically, the body's trying to keep yourself warm. So the different mechanism, it releases hormones. It releases sympathetic nervous system is activated. That causes your blood pressure to go up. It causes the narrowing of the vessel, and it causes more stress on the heart. And it causes increased pulse rate to keep your body warm. The body has to work a little bit extra hard. So that is why you see more people coming with heart attack, or more people getting more coronary artery disease during the winters. And especially you see all this, somebody's shoveling the snow, and then all of a sudden they started having chest pain, and then they come into the ED. So basically people who have not been working out, all of a sudden they start doing exercise. That's when the symptoms present and they come with a heart attack. So how can you make it safer? First, try to take it easy. You don't have to shovel everything in one go. You can take some breaks. You can do for 10 minutes, then take a break, come back, keep yourself hydrated. And then, know the signs. When you are not feeling well, call for help, immediate help. And, everybody should be certified in doing CPR in the community to help other people and to save other lives. Plus, do not try to drink too much alcohol when you are doing all this, immediately or afterwards, and keep yourself hydrated. Those are the other things. And we touch base on it. How can you avoid having a heart attack? All healthy habits. Smoking, no go. Smoking is number one cause, if not, other than diabetes and high blood pressure and cholesterol. Smoking is one of the most common causes of premature heart disease, where you can have blockage in the arteries, because smoking causes inflammation and increased destruction of the blood cells and your vessel epithelial. So you get more heart attacks when you smoke. Blood pressure, you need to keep a tight control of your blood pressure. If you've never been diagnosed with high blood pressure, you should try to keep your blood pressure below 120/80. then eating right food, getting your cholesterol down, and being physically active. So we'll talk a little bit about how much exercise you have to do, what kind of food you have to eat. We'll come in a minute on that, and getting your blood sugar in a lower level. And see your doctors regularly, see your cardiologist if you have heart condition and you're already seeing a cardiologist. So just do all those things. So we'll talk about blood pressure and hypertension. So what is hypertension? Hypertension is anything blood pressure, systolic. So there are two numbers that you have to remember. There's a systolic blood pressure, which is the top number, and there's a diastolic blood pressure, which is the bottom number. So top number above 120 or the bottom number above 80 is considered as high blood pressure. It doesn't necessarily mean that you have hypertension just by one reading. So you need to have consistent blood pressure elevation at least in 2 or 3 settings. When you're like relaxed, it's not like you made a big jog, you came running, or you had some physical activity and then you check your blood pressure and your blood pressure is over 150, then you say that you have hypertension. It does not work that way. So it has to be in a relaxed environment. You check your blood pressure. If it's consistently over 120 systolic and diastolic is more than 80, is considered as high blood pressure. And it is more common in male. 50% of the of American males are actually hypertensive, and 44% of the female suffer from hypertension. And it's more common in African American than the white people, then Asian, and then Hispanics. And the blood pressure control is also very poorly controlled. If you look at the studies, the blood pressure control is more commonly seen in white males than in black males, than in Asian, than in Hispanics. So all the Hispanics have a lower, incidence of having high blood pressure, but their blood pressure is difficult to manage and control. And then what are the signs and symptoms if your blood pressure is not controlled? So you can have stroke, you can have heart attack, you can have heart failure, you can have kidney disease, you can have sexual dysfunction. There are a lot of things that can go wrong if your blood pressure is not controlled over a long period of time. And as I was saying, so there are different stages of hypertension. So anything between 120 and 130 is considered as elevated blood pressure, but not that you need to be on medication. We can try with a diet. But once you reach above 130, the ACC and AHA, like our guidelines, recommend that somebody should be started on medications. So if it's between 130 and 139, and between the diastolic, the lower number is between 80 and 89, it is considered as stage 1 hypertension. We are obliged to give you a recommendation to start on medication. But definitely, if it is between 120 and 130 and between 80 and 89, we can consider starting you on diet and exercise and all those programs without starting the medication. And then when it reaches a very, very high level, we call it as if the top number is over 180, or if the bottom number is over 110 or 120, it is considered as a crisis, meaning you need to be admitted to the hospital. Then you have to control your blood pressure, because we don't want to drop your blood pressure too quickly down. Because you can imagine your arteries in the brain, in the heart, are used to seeing so much blood pressure. But if you acutely drop it down, then you can have a heart attack or a stroke. So that is why we have to admit you in the hospital, lower down the blood pressure gradually, and then go from there. What are the best modalities to kind of prevent people going onto the medication? What are the things that we can try to control the blood pressure? So weight loss is definitely one of these. So every 1 kg reduction in your weight leads to 1 millimeter reduction in blood pressure. And you can decrease on an average about 5 millimeter of mercury blood pressure down if you just manage your weight and do weight loss therapy. Healthy diet, we're going to come on it a little bit more in detail. So there are multiple, if you Google, you will see a lot of diets that have been offered nowadays, this keto diet, this diet. So the only recommended diet by ACC or by our guidelines is either DASH diet or Mediterranean diet. So DASH diet is basically, the dietary approach is to stop hypertension. That's the acronym. DASH is an acronym. So it basically tells you what kind of food you should eat to have a healthy heart and to decrease your blood pressure. So that consists of mostly eating healthy foods such as vegetables, more of green leafy vegetables, pulses, legumes, beans, avoiding red meat, avoiding a lot of saturated fat, avoiding a lot of salt, avoiding a lot of processed food or trans fat. Those are the things that you have to keep an eye on. Those are the things that you should eat less. All right. So, and then that has the biggest impact on reducing the blood pressure. On an average, you can reduce the blood pressure by more than 10 millimeters. Other thing is reducing the amount of sodium that you take. So if anybody has heart failure, we talk about decreasing the sodium intake, because that causes the retention of fluid in the body, or the water in the body as we call it. So you should try to like decrease the amount of sodium that you take to less than 1.5 grams per day. Basically 1500 milligrams per day is the aim. But you should ideally aim for almost like a gram a day. That's like, pinch of salt on the food is okay. It's not like you have to completely cut it down, completely stop it, but as less as possible you can. That also reduces the blood pressure by 5 or 6 millimeters. And the last one is enhancing potassium. Instead of sodium, increase the potassium. So diet rich in potassium actually helps with reducing the blood pressure as well. Exercise, a lot of exercise, lot of therapies, lot of exercise planning that have been going around. What exercises are the best? So aerobic exercises are always the best, which means like either swimming, making like, running laps. Those are the important exercises. And it is usually recommended to do at least 150 minutes per week, 90 to 150. So we're talking about at least like, 1.5 hours to almost 2.5 hours every week. You don't have to do in one day. You can do divided like 20 minutes every day is good. If you do even 20 minutes per day, it's like 140 minutes for the whole week, aerobic exercise. So if you run or jog for 20 minutes a day, which is pretty good. You can also do other exercises. There is dynamic resistance. Let's say you have a knee problem, you cannot really run, you cannot really do. You can swim, but if you cannot even swim, if it's cold, you cannot go out. You can do exercises at home. You can do, stretching exercises. You can do push-ups. You can do a squatting. These are the things. Those are considered as the dynamic resistance, where you have resistance through your own body. Then there is isometric resistance, which is basically lifting weight. So you can do small weights. That also helps. So any sort of exercise is good for the body. More you do, the better it is. But as per the recommendation, it's usually aerobic exercises for at least 2 hours to 2 hours to 2 or 3 hours per week in total. Then alcohol consumption, you should try to reduce the amount of alcohol that you intake, because all the alcohols, as you know, is carbohydrate rich. So it has a lot of sugar added to especially the cocktails that you drink, there is a lot of added sugars as well. The beer also has a lot of carbs in there. It is made out of starch. So try to reduce the amount of drinks. So usually the recommendation is less than 2 drinks for men and less than 1 drink for women. Cholesterol. So we were talking about what is cholesterol, what is a good cholesterol, what is a bad cholesterol. So there are different types of cholesterol in the body. The main thing that we focus is LDL or HDL. LDL means bad cholesterol, that you want to keep it as low as possible. L, low. H, LDL. H is high. You want to keep it high. So H for high, which is a helpful cholesterol. So HDL and LDL are 2 types of cholesterol. So when you eat, so the cholesterol is made inside the body also by the liver. And then there is an extra cholesterol that you consume from animal products, mostly like meat, eggs, poultry, from milk. Those are the extra cholesterol that you get into your body, that you consume, extra fat that you consume, full fat milk. Those are the things that gives you extra cholesterol. So your body is equipped to handle some amount of cholesterol that you consume, but it is not equipped to modify all the amount of extra cholesterol that you consume. So you have to keep an eye on it. So what it does, it basically like, you want to bring it as low as possible. So the recommendation are for the LDL cholesterol, which is the bad cholesterol, you want to keep it as low as possible, but ideally less than 100. Anything over 160 is considered as too much. So you should try to aim it to bring it as close to 100 or even less. For my patients who have a heart attack, we try to keep it even lower, like less than 50 is our goal usually sometimes. So the lower it is better. There are some people who have undetectable LDL in patients who have very, very high risk. We put them on so much therapy to bring it down so much, because there are studies that have done the lower is better, lower, as low as possible. And HDL, you want to keep it over 60 at least. So anything over 60 is good. For anybody, like for male, less than 40 is harmful, meaning it's not good. And for female, anything less than 50 is not good. Try to keep it as high as possible. What HDL does, it basically binds the bad cholesterol in your body and bring it to liver to get it excreted out. What LDL does, it basically takes the bad cholesterol from the body and get it deposited into the arteries. So try to keep the LDL as low as possible and HDL high as possible. Obesity, weight is another risk factors. As you know, more your weight, you're less active, you're more sedentary. Plus, it increases the risk of heart attacks, strokes, and also increases the risk of other diabetes, because excessive fat storage in the body can lead to diabetes and insulin resistance. So try to decrease your weight. Obesity is defined by the BMI, body mass index. So it's the weight divided by your height in meter squares. So the BMI, anything over 25 is considered as overweight. Anything over 30 is considered as obese. So you want to keep it a fair level between 18.5 and 24.9. So that is your range. Anything below 18 is considered as somebody is kind of on an extreme end, that malnutrition type. You don't want to be too skinny because you need body fat and muscle. So you want to be in that sweet spot range. Between 20 and 25 is actually a pretty decent number. So anything over 25, between 25 and 30 is obese. Overweight, I would say, not obese, and over 30 is obese. So this is how we calculate the weight, and you're divided by your height. So you can have a high weight, a lot of basketball players, they might be weighing 200 pounds, 300 pounds, but their height adjusts for it. So it all depends on how tall you are and what your ideal body weight is. All right. So diabetes, as I was saying, is a silent killer. It's it eats you from inside slowly, and it is the number one cause of causing leg amputation. Basically, patients who are bad controlled diabetes, poorly controlled diabetes, get peripheral vascular disease. When you hear somebody who's a smoker and has bad diabetes, have cramps in their ear, and they get infection constantly in their legs, and then somebody tells them that they need to chop off some of the digits in the leg because they're not getting enough circulation. So diabetes is one of those things. So it is the number one leading cause of causing amputation. It is the number one cause of causing kidney failure. It is the number one causing of blindness. A lot of people who have uncontrolled diabetes, it affects the cell inside the eyes and it can cause blindness. It is the number one preventable cause of blindness in the whole world. So, so you have to make sure that your diabetes is well controlled, and every year the numbers just keep on getting doubled. So whatever we were diagnosed last year, it doubles the number of people that are diagnosed with new onset diabetes and the complication because of diabetes. Almost 37 million people in US are affected by diabetes. 1 in 5 people have diabetes, and majority of them don't even know that they have diabetes. So as I was saying, these are the major complications. You see, people with amputations, they have no circulation. They can cause heart attack. It can cause kidney failure. It can cause stroke. It can cause heart attack. So you just have to really watch out if you have diabetes. And how do you define diabetes, right? So the definition as per the classification our society says, your HbA1c, which is hemoglobin A1c, it is an average of 3 months of your sugar in your body. So if anything is more than 6.5, if you go and get your HbA1c checked, anything that is 6.5 and above, it is considered as diabetic range. All right, between 5.7 and 6.5 is pre-diabetic, meaning you are at risk of developing diabetes. So this is the high time that you start working on yourself, losing weight, eating healthy, working out. So you can get into a non-diabetic range, which is 5.7 and below. So anything below 5.7, it is considered as normal. Anything between 5.7 is 6.5 is pre-diabetic, and above 6.5 is diabetic range. We talked about exercise. For kids and teen is different. They should be working, they should be physically active for at least 60 minutes a day, either with some sort of sports. Now you see a lot of kids, just being on the screen. They don't work out. They just want to stay at home. They don't want to go and play outside in the field. We should promote them to go out in the community, play with the friends, do some physical activity. And it is usually recommended at least 60 minutes of physical activity every single day. Exactly, every day. That is at least, that is recommended for kids and teens. And, we were talked about the diet. I think there are 2 diets that are important. You can, easily find it. If you Google DASH diet or you Google Mediterranean diet, you can see a lot of charts where you can find out what is the healthy diet, what you should be eating, what you should be avoiding. But I says anything that is rich in fibers, a diet that is rich in fibers, green vegetables, plant-based proteins, and less processed meat, less trans-saturated fat, less processed food. Those are the things that you have to keep an eye on, because a lot of snacks, we have a lot of snacks here and there, they're all filled with saturated fats. So you just have to keep an eye, especially the processed food that we buy that have a lot of trans-saturated fat or processed meat. Those are the things that you have to avoid. And home cooked food is always better, but you can control, because when you go out in a restaurant and eat, you don't know what is put in your plate. So those are the things that you have to, and exercising, avoiding excess of alcohol, drinking a lot more water, that always helps. Let's say, you are doing everything right and you still doubt that, hey, what is my risk of having a future heart attack? So there's a simple test called as coronary calcium score that you can do. It is usually recommended in people who have some risk factor. Let's say they have a family history of a heart attack, but they don't have any risk factors per se. They don't have diabetes, they don't have cholesterol, they don't have sugar or anything, but still they're a little risk of having a future problem. So how do you know if they're developing any silent plaques in the body, right? You want to know if you're having any plaque buildup in the body. So you can do this coronary calcium scoring, which is a simple test. It's like lasts maybe 5 seconds. You go in a scanner, in a CT scan. Like how would you get a CT scan of the chest? You get a CT scan of the chest and they can calculate if you have any calcification in your arteries. So whenever there is a plaque built up, there is always some calcification in the arteries that can deposit. So you can detect. If your score is 0, then you can be assured that there is no plaque buildup in your arteries and you're good. And we usually recommend to do it every 5 to 10 years to see if you have anything building up silently. So that is a good. Anything over 300 is considered as bad, meaning that you already have developed some blockage in the arteries. It might not be obstructive, meaning like it is not compromising the blood flow, but it is high time that you change your lifestyle habits. All right, anything between 0 and 300, or between 100 and 300 is considered intermediate. All right, so over 300, bad. 0 is good. Any questions? I'll take questions.
At what stage in life would you recommend somebody see a cardiologist just for baseline?
I would just see a regular doctor. You don't really need to go and see a cardiologist. So cardiologists are specialists. They help people, but there are a lot of doctors in the community now that they practice both cardiology and internal medicine, which is a very good thing. They can manage both things. But I usually tell patients, if you are working on yourself and you're seeing a doctor regularly, which is a primary care doctor, you don't really need to go and see a cardiologist by itself, unless and until you're a very high risk. Let's say the family has a very strong history of heart attacks in the family, and you're a very high risk, you have already been diagnosed with high blood pressure and cholesterol, then yes, you should see a specialist. But if you don't have risk factors and you don't have any family history and you are doing everything correctly and you're seeing a regular doctor, you don't need to go and see a cardiologist as a primary care. Your primary care provider should be able to handle all those things. Yeah.
You're saying the high meat diet is not good for us?
Red meats.
Red meat.
Yeah, red meat. Like fish, grilled chicken, those are good.
So like someone that's on a vegan diet is very good then?
Probably yes.
Probably?
Yes.
So you're saying white meats and things like that are good?
Yes. Red meat, it's not like you have to prohibit yourself. It's just in moderation. Meaning like once in a while is okay. But eating steak every night is not good.
No, I do moderation.
What about vitamins like CQ10 or those that they advertise? What do you think?
So they're not harmful, but they have not proven to be effective in preventing you from getting a heart attack. So they're good overall for the bodies. You take vitamin supplements and everything, but it does not necessarily translate into having better outcomes. So they're not harmful either. So you can take it.
Aspirin, mini aspirin.
Oh, that's a very long debate topic. So there's a lot of studies been done because it was promoted as the best thing possible. And a lot of people were just put on aspirin for prevention. Primary prevention we're talking about, basically preventing you from a heart attack. But the newer studies that have done in population, there are a lot of studies that are published in the last 2 years. They're showing no benefit, actually harm, of taking a baby aspirin. It is good for secondary prevention, meaning if you already had a heart attack or if you already had an event of stroke or a heart attack or something else like, related to that, then yes, aspirin is good and you should take it. But you never had any event and you are at low risk, then aspirin is not beneficial. It actually is harmful because it increases the risk of bleeding. To prevent to prevent any one heart attack, There are 5 people that bleed excessively because of that. So for primary prevention, maybe no. For secondary prevention, yes. Primary prevention meaning like you never had any event and you're at low risk, there is no need for aspirin. But you already had an event, then yes, aspirin is good.
What isn't the purpose to lower the blood pressure?
For aspirin? No, aspirin has nothing to do with the blood pressure. Aspirin is a blood thinner that prevents the platelets to stick together. So when you have a heart attack, what happens is your platelets get stuck, like when you have a clot formation, all the platelets stick to each other. So aspirin prevents that platelet sticking. It also causes bleeding based on that. So that is why you have to weigh the risk and benefit. And the benefit, nowadays the literature is saying that the benefit of preventing a heart attack is less and it causes more bleeding. Yeah.
What about traveling? Let's say you go on a flight that is 20 hours,
Okay.
Australia.
Yeah.
What do you take?
Like taking medication wise?
No medication or prevention?
I mean, they usually, yeah. So what we usually tell patients is just be active. Like don't sit there for 20 hours straight. Every hour or 2 hours, stretch your legs, go, stretch your back, move around a little bit. What it does is, like what the main risk is when you're traveling such a long distance, especially when you're elderly, the veins in the leg, they lose their capacity to pump the blood all the way to the heart. So when they have a stagnant blood for a long period of time, you can form clot and it can cause a clot that can travel to your lungs and can cause pulmonary embolism. So what we tell patients, which they are very high risk, especially like females who are smoker, who are postmenopausal, when their hormonal changes are happening, they are at very high risk of having a blood clot develop and that can cause a clot that can go into the lungs. So keep yourself hydrated, move around every 1 or 2 hours, take a water break, take a pee break, just move around so your blood is circulating. So when you move and you walk, those leg muscles are like, working and that blood can circulate easily. But you don't have to take any prophylactic medications when you travel. No. Yes?
What is an aneurysm?
Aneurysm is just a dilation of the artery. So aneurysm can happen in a lot of conditions. The number one cause of causing aneurysm is hypertension. When your blood pressure is not being controlled for a long period of time, it can cause aneurysm. Aneurysm is basically dilation. I showed you the diagram where there were 3 layers of the artery, right? So what happens is the intima and the media, it gets stretched too much. So let's say your blood pressure is running 200 over a period of 2 years. So what happens is that artery can get stretched and can cause aneurysm. Some people have genetical predisposition. Basically, their arteries are weak. That happens in families, that you see aneurysm of the aorta. When you see commonly young people in their 40s and 50s have dilation of their aorta, that is genetic. Sometimes smokers, like smoking also causes the weakening of the arteries and smoking of the dilation of the arteries. So you see, that is why we recommend anybody who's ever smoked and has age of over 60, we recommend to do an ultrasound of the belly to make sure they don't have aneurysm. So that is for screening. We do screening for anybody who's smoked ever and they are over age of 60. We do one-time screening to make sure they don't have any abdominal aneurysm. Anything else?
I'm here, that's all I'm at.
If someone thinks they're having a heart attack, what do you recommend that they do?
So call 911, of course. You have to call for help. Don't wait, because a lot of people actually don't make it to the hospital. Unfortunately, that's the sad part. If somebody has a major heart attack, sometimes they just don't make it, or they come too late when they already have the cardiac arrest. So every second counts then. So you have to call for help immediately. If you have a family member, they can make a call. If there's nobody around them, just call 911. If you have baby aspirin lying down at home, you can just chew at least 4 baby aspirins. So that can help. So as I said, aspirin prevents the platelets sticking. When you have a heart attack, you have a blood clot and the platelets start sticking and closing the artery. So if you take aspirin, that can help you. All right, so call for help. If you have aspirin, take aspirin.
You just said chew the aspirin?
Chewable aspirin, yeah.
Before you swallow.
Yeah, you can chew the aspirin. You can chew and then swallow, yeah.
I think I'm having a heart attack.
So that's to
Yeah.
get it in faster, right?
Yes, that helps you get absorbed faster. Yeah. All right. Not a problem. My contact information there. Thank you guys. Appreciate it.